Welcome back! We're continuing our series on adult telomerase-positive stem cells, or aTPSCs, and we're just going to skip the usual agenda today. We are diving straight into what might literally be the most gripping, unbelievable medical mystery we have ever covered in an explainer. Today we're looking at a clinical trial that started out as a desperate final attempt to save a terminal patient, but it ended up challenging absolutely everything we thought we knew about human biology, identity, and what makes you, well, you.
To really appreciate the miracle here, you first have to understand the nightmare. The subject of this clinical trial was a 61-year-old man who had been battling systemic lupus erythematosus, or SLE, for 31 years. SLE is this brutal autoimmune disease where the body essentially attacks itself, replacing functional tissue with non-functional scar tissue every time there's a flare-up. By the time this trial began, he was at stage 4 terminal. He was given just 2 weeks to live. His major organ systems, like his heart and lungs, were functioning at 25% or less. He summed up his existence at that point in just 4 words: basically a living hell.
Okay, let's dive into this because the physical reality of his condition is almost hard to comprehend. The internal scarring from decades of SLE had literally tethered his spinal nerves directly to his vertebral column. We're talking severe tethering spanning all the way from his T1 down to his S5 nerves. This was causing 24-hour, severe, unyielding neuropathic pain throughout his upper and lower extremities, as well as the entire trunk of his body. And on top of all that, he was suffering from excruciating cerebrobrisitis. This caused relentless cluster headaches, which are often called suicide headaches in the medical community because the pain is just so absolute.
To manage this unbearable agony, his doctors had him on a monumental protocol of painkillers taken simultaneously. Listen to this regimen. Every 4 hours, he was taking 64 milligrams of hydromorphone, 4 times the maximum dose of gabapentin, 2 times the maximum dose of baclofen, and 12-hour maximum doses of aspirin, ibuprofen, naproxen, and Tylenol. All of that taken together every 4 hours. And you know what the truly terrifying part is? This massive, heavy-duty pharmaceutical cocktail barely even scratched the surface of his neuropathic pain. Traditional pharmacology had completely failed him.
That brings us to Section 1, the multi-pronged protocol and mapping the intervention.
With immunosuppressants and typical drugs doing absolutely nothing to halt the disease, his medical team had to pivot. They initiated an experimental intervention using adult telomerase-positive stem cells, or aTPSCs. These include totipotent, pluripotent, and mesodermal stem cells. Now, unlike typical adult stem cells that have a limited lifespan, aTPSCs possess the telomerase enzyme. This gives them an unlimited proliferation potential to go in and repair that non-functional scar tissue. For this patient, the team used both autologous cells, meaning cells harvested from his own body, and allogeneic cells, which were donated by healthy individuals. The administration wasn't just some simple injection. It was a highly targeted, multi-pronged approach mapping exactly to the organs that were failing him. Step 1 was an intranasal infusion of totipotent stem cells, specifically targeting the central nervous system and brain. Step 2 involved a slow IV infusion right into the Thebesian venous system to deliver cells directly to his failing heart. Step 3 was nebulization, where he actually inhaled the stem cells straight into his lungs to combat pulmonary fibrosis. And finally, Step 4 was a regular IV infusion of cells into the systemic bloodstream to tackle the broader autoimmune issues. Moving on to Section 2, the climax of the story, 15 years later.
So what actually happens when you flood a failing body with specialized repair cells like this? Well, the immediate effects were staggering. That relentless neuropathic pain? Gone. His reliance on morphine and heavy painkillers? Totally eliminated. The cluster headaches dissipated, and his heart and lung functions rapidly stabilized, buying him crucial time. But here's the massive reveal. Against all medical odds, having been given a 2-week terminal diagnosis at stage 4, this patient is miraculously still alive 15 years later.
The medical successes documented over his rounds of treatment are just phenomenal. His vital organs, which were failing at 25%, rebounded to 70% function or higher. His neurogenic and pulmonary symptoms were vastly reduced. But honestly, my favorite part of this is a fascinating anecdote that perfectly highlights how these stem cells act as an intelligent triage system. During his 8th donation period, he had recently suffered a severe, life-threatening spider bite on his ankle. Instead of traveling to his internal organs as intended, the activated stem cells sensed the immediate trauma, diverted entirely to his foot, and perfectly healed the open wound in under a week. It left pristine skin with absolutely zero scar tissue. His body literally prioritized its own repairs.
And now for Section 3, the twist, the human chimera.
This is exactly where the story takes a sharp turn from a miraculous medical recovery into something entirely mind-bending. The allogeneic stem cells, the ones from his donors, brought a little something extra along for the ride. Because the intranasal infusion intended to heal his central nervous system bypassed the blood-brain barrier, researchers discovered that this specific pathway caused the patient to literally absorb and express the physical and personality traits of his stem cell donors. This is where we get into the truly bizarre side effects of becoming a human chimera.
Just look at his hair color timeline, because it reads like pure science fiction. Initially, before the treatments, he had sparse, white hair. His first donor was a 42-year-old male with auburn hair, and sure enough, the patient grew a full head of auburn hair. Then, for his second through sixth donations, he received cells from a donor with black hair, and boom, his hair turned completely black. The seventh donation shifted it to a full head of sandy brown. Now, the eighth donation, as we just talked about, was diverted to heal that spider bite, so no hair changes occurred then. But from the ninth donation onward, his body settled into this bizarre, permanent mosaic. Today, he has predominantly black hair, but heavily streaked. Not patches but streaks, of auburn, sandy brown, and his original white. He is literally growing the hair follicles of his donors.
And it absolutely wasn't just physical traits. His food preferences fundamentally altered too. One of his donors was an 80-year-old O-negative male. Suddenly, the recipient gained this donor's highly specific cravings. Out of nowhere, he developed a brand new, overwhelming love for pimento cheese, a food he had either refused to eat or literally couldn't eat since birth. But humorously enough, he firmly continued to reject blue cheese, leaving that particular preference off his plate for sure.
The deeper you look into these chimera side effects, the wilder it gets. His immune system was essentially wiped out and rebuilt using the blueprints of 4 to 5 different individuals. When he received cells from an aggressive donor, he became noticeably more aggressive. When he got cells from a mellow, laid-back donor, his personality shifted right along with it to match. Medically, he permanently lost almost all his lifelong allergies. Things like wool, milk, polyester, and latex simply stopped affecting him altogether. But he actually gained a brand new allergy to soy protein, purely because his O-negative donor had a soy allergy.
And this brilliantly illustrates the incredible hypothesis the researchers formulated. Because the lupus flares had totally depleted his native immune cells, the healthy, telomerase-positive allogeneic stem cells didn't just support him. They essentially replaced his genetically defective immune system altogether.
Which leaves us with a truly provocative question to end on. If your active cells, the color of your hair, your immune system's allergies, your personality traits, and even your favorite foods actually belong to someone else, what exactly makes you, you? It's a medical leap that pushes the very boundaries of human identity. Thanks so much for joining me for this explainer, and keep questioning everything.